Taisha Foster, and this is my report on lupus. So lupus is also known as lupus erythematosus. Lupus is the Latin word for wolf. Erythematosus is derived from the word ethos, meaning red. The 13th century doctor that discovered this or named this disease, he used that name to describe the reddish lesions on the face. He said that they were like a wolf's bite, so that's where that name came from. Lupus is an autoimmune disease. It causes inflammation and pain in any part of the body, mostly in the skin, joints, and your internal organs. There are 4 types of lupus. Systemic lupus, that is the most common lupus, or most common type of lupus. Cutaneous lupus, which is lupus in the skin. And then there's drug-induced lupus, which is brought on by like prescription drugs. And there's also neonatal lupus, which is lupus that's developed when you're born. So 9 out of 10 people who have lupus are women of childbearing age, ages 15 to 44. It mostly affects women of color, so you're 2 to 3 more times likely to develop lupus if you are African American, Asian, Native American, Hispanic, Latino. So 1 out of 3 patients with lupus also have another autoimmune disorder. There are 16,000 new cases each year, and there's 1.5 million Americans with this disease, and then there's 5 million people worldwide with lupus. So there's no known cause for lupus. Professionals think it could be brought on by environmental triggers or response to hormones. The symptoms come and go, which is called, symptoms come and go. They can cause extreme fatigue, pain, swelling of the joints, hands, feet, headaches, and low fevers. Sensitivity to light or fluorescent lights, those are the most common symptoms. Less common symptoms are chest pain when you're inhaling, rashes or sores on the cheeks and nose. I included on the introduction slide some of the lesions that can be caused by lupus on your face. You may also experience hair loss and also Raynaud's disease, which is whenever you experience coldness, your hands and feet swell up. So there's not an official test to determine whether a patient has lupus or not. It can take months, even years, to diagnose this. There are several factors that the doctor will look at to diagnose this. Blood, urine, and biopsies tests can be used to determine if your immune system is working well or if there are signs of inflammation in your body. Like I said, there's no cure for this, but your doctor can come up with a treatment plan that's right for you. So autoimmune means that your body cannot tell the difference between foreign invaders or your body's healthy tissues. So then the body creates autoantibodies which attack the healthy tissues. That can be seen on slide number 5. And on the first picture, or the first number 1, it shows like how a trigger such as the environment or even your genes can bring on this disease. And then the second one shows how your body reacts to it with the autoantibodies. And then the third shows how it can affect your internal organs. So you can have flares with lupus. They can be triggered by emotional stress, cold or viral illnesses, exhaustion. Some flares pop up without symptoms. Lupus is not contagious. You cannot catch it. from someone else. You can't pass it on unless it's passed through genes. So treatments such as anti-inflammatories like aspirin, acetaminophen, and NSAIDs, they're used to treat lupus. There are steroid drugs as well, such as corticosteroids and immunosuppressives, used to treat this as well. So if you have a blood clot with lupus, it can be life-threatening, which you'll need anticoagulants to thin the blood. So Benlysta is one of the antibodies used to reduce the antibody levels. It's a monoclonal antibody. It's used to control this disease. It's the first and only drug developed and approved to treat lupus. There are also respiratory corticotropin injections that can help your body naturally produce hormones, steroid hormones on its own. So most people living with lupus say it takes a really heavy toll on their daily life. 65% report that chronic pain is the most difficult part of living with lupus. 89% of people cannot work full-time due to lupus. 79% of people have been forced to cut back on their social lives because of fatigue caused by lupus. Patients with lupus can also experience depression. It affects their cognitive function, such as brain fog, memory loss, and trouble concentrating. It can also affect your sex life. You may feel a lack of desire. Regular evaluations are necessary to make sure that there is no life-threatening organ damage. And 50% of lupus patients may not have non-life-threatening symptoms. So if this is left untreated, the survival rate is less than 50%. But now with medications and treatments, the survival rates are over 95%. So there are several continuing medical education programs to increase knowledge, skills, and professional performance of healthcare providers. Clinical trials are also being studied for other drugs and treatments to be approved. Stem cell transplantation is one of those. And the Lupus Foundation of America is actually the first organization to co-fund the study of stem cell research. And they've committed over $4 million to this research. So a well-known celebrity that struggles with lupus is Selena Gomez. She was diagnosed with this in 2012, which is only 20 years old. She said that she's had anxiety, depression, and panic attacks because of this. She even admitted into a rehab facility to deal with this disease, where she underwent chemotherapy. This caused her to have to take a step back in her career. She went into hiding. She didn't really tell anybody about it. But then in 2017, she received a kidney transplant due to her lupus nephritis, which is what she was diagnosed with. So her kidneys were failing. So I included an interview where she reveals what it was like to live with lupus, the transplant process, and basically how her quality of life has changed after receiving this.